Good morning, and thank you for attending this the last committee meeting of the Adult Health and Social Care Policy Committee for this municipal year. Welcome to everybody, whether you're here in person or listening in. The meeting today is open to the public, and the meeting will be webcast, and the recording will also appear and be available for people to view later through the council website. It is also possible that Sheffield Live TV will record and rebroadcast this meeting. We have not received any petitions or public questions by the deadline, therefore there are none. Please may I request that mobile phones and other such equipment are switched to silent mode so as not to disturb the conduct of the meeting. There is no fire test planned for today. If there is an emergency evacuation, please take instructions from the town hall staff, and the assembly point is Tudor Square. I will now ask my colleagues to introduce themselves. I'll start with members, and I'll start on my right so that Councillor Rooney has time to sit down and log in. Councillor Hurst.
Thank you, Chair. Hello, my name's Diane Hurst. I'm an elected member for Richmond Ward.
Councillor Sophie Thornton for Beechcliff and Greenhill and Deputy Chair of the Policy Committee.
Councillor Steve Harris, member for Graves Park Ward.
Dr Will Sapwell, member for Stallington Ward.
Good morning, my name is Martin Phipps. I'm a councillor for City Ward.
Good morning, Councillor Mick Rooney from Woodhouse Ward.
Good morning, Councillor Ruth Milson, representing Crooks and Crosspool Ward.
Morning, Councillor Laura McLean, member for Walkley Ward.
Can I ask the officers to introduce themselves with Alexis on my left?
So I'm Alexis Chappell, I'm Strategic Director for Adult Care and Wellbeing in Sheffield City Council.
Good morning, Robert Parkin, Assistant Director Legal.
Joanne Cooper, Democratic Services.
And we also have Amia, who's doing all the tech stuff, the clever stuff on the side there. The agenda and reports for today's meeting are available on the council website, and paper copies are available here on the desk in front of me if anyone needs a pack. Apologies for absence. We've received apologies from Councillor Julie Grokert, and Councillor Diane Hurst is here as a sub for today. Item 2 is exclusion of press and public. There are no exclusion of press and public on any of the items on the agenda. And I will go on to item 3, which is declaration of interest. Are there any members who have any interest on any of the items on the agenda? Brilliant. Item 5, as I said previously, we haven't received any questions or petitions. And therefore we go into number 6, which is members' questions. Members are allowed to ask questions of the committee, but we haven't received any. The members are very involved in briefings, so I would be surprised to receive a question, but we haven't received any, so we can move on to item 7. Sorry, I missed item 4. Apologies, just because I jumped a page. Item 4 is minutes of the last meeting. Sorry, these are on page 11 of the report. I've read them and I couldn't see anything in there that was incorrect. Do anybody else has spotted any errors or matters arising? So can we agree that those meetings are a correct record of last month's meeting, of 2 months ago meeting? Thank you. And so, sorry, let's go back to item 7, which is the work programme. This is on page 19 of your pack. It looks a bit sparse, obviously, because it's the new municipal year and it's not been filled in, but we had a meeting was it last week, with members of the committee, and we looked at items that we would like to be on there, and officers are going to ensure that all the things that are coming back to us for scrutiny are going to be timetabled. So I assume that in June we'll see a much kind of fuller programme for the following municipal year. And if there are any items that members or groups want to see in terms of policy and things, just get in touch and we will make a note and we'll work things in. Are members happy with the work programme? Can we approve it for now? And remember, it's a working document, so it changes all the time as things are moved about anyway. Brilliant. So that's approved. And item 8, adult care and wellbeing budget, risk management and financial governance. This is on page 33 of your pack, and I think Jonathan is coming to present it. I've assigned 15 minutes for this item, so just members indicate if you want to speak, please. Oh, and Liam, thank you.
Morning, everyone. Jonathan McKenna-Moore. I'm the Service Manager for Business Planning and Governance in Adult Social Care.
Hi, morning everyone. Liam Duggan, Assistant Director, Care Governance and Financial Inclusion.
So this is the 4th quarterly report, quarterly update on the recovery plan and financial position. There's been a slight improvement since December when we last reported to the in-year position, and that's due to some additional income that's been received since, and also consistent control on spending. So we're now reporting a 2.9 million overspend for the in-year position. We're starting to see some more positive trends in terms of the long-term costs being stable. That's always offset by sometimes we get new people coming in at a high cost if they have complex needs, but we're starting to see the general trend of cost reducing. Of the 24.4 million total savings that were required this year, we're forecasting 18.2 million delivery, so that's 75%. And December's forecast that's updated since December's forecast slightly. That included some savings that related to residential rates and joint efficiencies, which we were forecasting as deliverable this year. Those have now become part of next year's recovery plan. So that's the change that's happened since December. As previously reported, there's an underlying overspend that's to be addressed in the next financial year by our recovery plan, and provided Appendix 1, which gives a breakdown of that with some more detail than when we previously published it in January and November. So we've just put in some extra detail to explain what's a slipped saving from this year that we're still planning to deliver, what's a new proposal, and what's in the recovery plan that's reducing our overspend as distinct from what's in the year's budget plans, which is about reducing the new pressures that are coming in. And also it's a bit of an explanation of what's reducing a contract cost and what's reducing the volume of support provided. That's also to reassure you that these savings are about reducing costs in that way. It's not about reducing access to service. The next section, there's an update on the reviews that we've been carrying out this year. So we're forecasting a saving of 4.3 million, and that's over 1,900 reviews across the city. As we start the new financial year, the plan is to hand the review work completed by agency teams this year to our review and enablement teams. So 2 of those teams have been recruited to, one in Future Options started in January, and another one in Living and Ageing Well will start in April. And then there's plans in development for further teams or investment that need to take over that work. And that's especially around improving the transitions work that we've already started on. And then there's a section on the with an outline of the business planning timetable for the 25-26 budget planning. So we've started discussions in service already, and we'll be working to a December committee date to come back with our proposals, and we'll be available for briefings over the summer. In the meantime, for example, finance colleagues are working on the financial strategy, so that will be in the summer. We'll have some more detail on pressures that we'll be able to brief you on then, and have a discussion about how those pressures have been built up and what they mean. There's an overview of our risk management approach, just how that aligns to the corporate strategy. And then there's the last item, which is the item for decision. Hand over to Liam.
Thanks, Jonathan. So we're bringing forward a small number of proposals that are described in section 1.7, which are amendments to our charging framework for the storage and management of personal property. So at the moment, for the estates of people who have died and where there's no one to arrange a funeral, it's our duty to arrange for a funeral, and that may include a search of the person's property and storage of any valuable possessions, and we make a charge for the property search. We also have equivalent duties, I guess, under the Care Act, where there's nobody no one able to support a person who is being admitted to residential care. We have a duty to search property and secure any possessions on a temporary basis. The council has a power to recover reasonable costs for those activities, but no charge is currently made. It's a small, relatively small sum. What we're looking to do today is seek approval to bring the charging of property searches for people who are going to residential care into line with the estates of people who have died and who have no one to arrange the funeral for them, so that there's an equivalent charge, and that is consistent. We're also proposing to bring in a small charge for the storage of items. So at the moment, items are stored. The number of items is increasing. We need to make sure that the items, that people's property is kept safe and stored in an appropriate way, and we're looking to make a small charge to support that. We're looking to update the fees in line with inflation this year, and also to implement an indemnity form which will allow the release of small sums of money from people's accounts where otherwise the council would hold on to them because it's not financially viable for the families of those people to make the necessary legal arrangements to get that money back. So the council is holding on to large amounts of very small sums of money because it's not in the family's interest to recover it. We're looking to make that process simpler and allow the release of those personal monies back to the estates.
Thank you. First of all, I want to say thank you to the team for keeping us really up to date, and I feel very reassured by the fact that we're keeping such a close eye on, our recovery plan, and seeing the plan for next year as well. The timing is really useful, actually, because it just puts everything, slots in for us as well, what to expect, etc. So that's really good to see. I have Councillor Aries who's indicated. Is there anybody else who wants to speak on this item? Okay, Councillor Aries.
Thank you, Chair. Thanks for the report and the update. Page 36, I'm looking at Table 1 and the recovery reviews. And I do recall when we took the decision to the invest to save measures to where we took on agency staff. Just wondering where we're at with that. The table says that we're on 63%. I mean, what's behind that? Could you just elaborate on what's behind that, and how long will we be engaging agency staff? I know it's, where do you think we'll? How long it will take to keep on those agency staff? To balance the budget effectively. Thanks, Chair.
Sorry. So as I was describing earlier, the plan is that those agency teams, they should come to an end at the end of this month. Just checking whether we need capacity in specific area around residential care reviews to ensure that we have the necessary capacity there. But on the community reviews, the plan is to hand over to our own teams going forward. The behind that percentage on delivery. So a lot of the reviews that the agency teams have been doing, they've been doing well. In that total, there were savings against what was called strengths-based reviews, and that was about controlling the increase of packages in year, and that is the sum that's moved into the recovery plan, and that's become part of the delivery plan through the new enablement team in future options. So that took a substantial amount out of that percentage. That's why it's down to 63%. But it should be recoverable next year now that we have that team in place. That's the team that started in January.
Councillor Rooney.
Thank you, Chair. It's I think for the benefit of anybody that might be watching, I'm just wondering if we could inform the public where we're going to be in terms of our starting position, in terms of expected savings for next year. I think it's quite pertinent given the number of councils that are falling over because they haven't got the money to provide even basic services in some instances. I'm just wondering if you could, anybody that is interested in watching, give us an idea of where we're going to be in terms of the starting point in terms of savings for next year, please.
Thanks, Councillor Rooney. So we've got around £30 million worth of savings that the committee is looking to deliver over the course of the next year. £13 million worth of savings that mitigate new pressures, and around £17 million of recovery activity to tackle underlying overspend. We've brought forward the plans to this committee over the last few months and an updated recovery plan last month. Plans are well underway. We're working with finance this month on the month zero forecast, so what's our first forecast for savings delivery, and working really hard to make sure that the savings are delivered optimally as much as we possibly can. The challenge is scale, but we've got a good range of activity that's already way to deliver those savings.
And I wasn't making any insinuation that you weren't keeping us informed or you weren't doing your best to deliver. I just wanted the public to know what they're facing over the next 12 months in terms of potential savings and the effect on the services that they might be getting. That's all. I just find it quite ironic that we've turned a corner. We seem to run into a blank alley when we've turned this particular.
The savings that were approved by this committee were all savings that were in line with our vision and strategy. So there was nothing that this committee has approved that was cutting services or reducing. There was a large focus this year on additional income, but also optimising, supporting people to greater independence through better support out of hospital, better support through S2A, somewhere else to assess, and other approaches such as that. There's also a significant aspect to the recovery plan this year, which is in relation to learning disabilities, improving the range of accommodation, short breaks, support for people with complex needs, so that we're able to support people at lower cost in the city. So what we're hoping to do here is pull off the trick where we're actually improving services and making things better for people, whilst reducing the cost of the public purse.
Thank you. And can I just, support that? And we've said loads of times in this committee and in briefings how we are, delivering really good services in spite of, the fact that we are underfunded as a local government, in general, and that this is across the council. And I'm really proud that we are looked at outcomes for people in everything that we've agreed in this committee. And that doesn't mean that, we have rose-tinted spectacles on. It's just we know that there are challenges, but we've been optimistic in the way that we are kind of looking at things and trying to find ways to deliver better services, despite the fact that we've got less money to do it. So hence the, working on better outcomes for people, working on prevention, enabling people to be more independent and living better, living longer better. And that's what we want, really. So it's that kind of investment in people rather than looking at just the money. Councillor Thornton, did you want to come in?
Thank you, Chair. Thank you for this. It's very comprehensive as always, and this, thank you for keeping us so up to date. There are a couple of questions that I've got, just as I think Councillor Rooney has kind of laid out. I think it'd be good for it to be laid out for the public as well, because we are seeing that trend of people getting increasingly complex needs, and there is obviously the ongoing pressure of the increasing cost of non-standard residential care. And we know that there are people that are going to be coming through the pipeline that are going to need that. As when we look down towards people trying to get placements in schools and learning disability, people are getting increasing complex needs that may well be coming down the line and need that kind of care from us in the future. So just I suppose for a more public reassurance for anyone watching, can you outline what future planning is going to look like for that a little bit? And then also it's more of an operational question on page 49, I believe, with the care package approval on 19. I know from when Councillor Argenzio and Councillor Milsom and I have visited various places, the main issue that tends to be fed back is the operational stuff on Liquid Logic and the IT. And we've seen that that's one of the ones. I mean, like a lot of this is on track, but this is one of the things that has not been started yet, and that integration with the financial systems has slipped and to be delivered by November. So just wondering if you could talk us through the rationale behind that.
Yeah, so the care package approvals is a software development, and it's with the team for development. There has been a queue of developments, and we've been prioritising them. And the developments that we've been making have been, we've been prioritising items around safeguarding, but also the implementation of the new care and wellbeing contract. So it's just a question of timing and bringing that forward in due course. So that is, it's a module that will be introduced at the appropriate time. In terms of the increasing the complex needs, we've got an LD strategy that we brought forward to this committee. I think it was in November, which set out our intentions around commissioning and the support of people with more complex needs. There's been a lot of activity taking place over recent months to bring forward new council-delivered services for people with complex needs, making use of existing facilities and bringing new units into use. And that activity will continue as we look to broaden that out and develop efficiencies over the course of this year. I think that would be something that would need colleagues from our Adults Future Options team and commissioning team to come in and provide a better update on that.
Do you want to come in?
Maybe just come in as additional, just to add here is later on today you'll hear from Catherine actually about some of the work to transform care homes, and a lot of that has been a crucial piece of work, to ensure that we're working with our colleagues in care homes to look at our overall provision in the city And that will help us not only to think about the future of models of care, but also how we could deliver better, improved outcomes for people, but also within the financial envelope that we have. So Catherine and actually colleagues will be able to speak about that later on today. Equally, I think just coming back on a couple of points is, I think what's really important we've really tried to do with an adult care is focus on improved outcomes for people and improving their performance, but doing that within the financial envelope that we have. And that has been our key focus. And we've really striven, particularly in this last budget, this budget setting process, is to not make cuts to services. What we've tried to very much focus on is actually invest to save. And we've actually taken that approach and trying to work through different models of care so that our focus continues to remain on ultimately improving lives and outcomes for people of the city. And it's that is always a challenge for social care. But I think, we've got a very good team who are up for it and who want to do that. And that's the positive message that I want to give to the public as a very committed and positive team.
Thank you. I will take that as at the end of the discussion, and could we look at the recommendations for this report? They're on page 34 of your pack, and we have 4 recommendations. Approve the proposal to update the property charges. Note the update to the financial forecast for the delivery savings in 23-24. Note the updates on governance and risk management, and request an update on the progress with implementation through our budget delivery report for future committee. Are members happy with those? Brilliant, thank you very much. Thank you very much to the officers. And we go on to item 9, which is the Adult Safeguarding and Ensuring Safety Delivery Plan Update and Safeguarding Board Annual Report. And I believe Andrew is presenting with Dawn.
Hello, I'm Dawn Bassender, Chief Social Work Officer.
Good morning, Andrew Drummond, Service Manager for Safeguarding Quality Assurance.
So we're here today with the 3rd update on the progress made on the Adult Safeguarding Delivery Plan.
Thank you, Dawn. So I've come to give us a catch-up on the delivery plan and also some of the key highlights within that. So first of all, within that responsibilities guidance document. So in September's committee, we brought the draft of the responsibilities guidance document, which gives a framework for partners across the city, supporting them to know when to refer to the local authority to adult care and wellbeing with a safeguarding concern. There's been a lot of really positive progress on that, a lot of engagement with the voluntary sector. We had an event at St Mary's in January where we had 40 attendees from various VCF groups there, where we received a lot of really positive feedback about the document, areas where we've amended it, and also within that meeting as well, it wasn't just about that document, but provided them with an update about safeguarding in the city and what's happening with the multi-agency safeguarding hub and how they can access support, which we received a lot of positive feedback about. And within, to support that document as well, we've also been working with other partners, such as the Integrated Care Board. So there's been a lot of work that's gone into that since September to bring it to where it is today, for where we seek approval from yourselves so that we can send that to partners across the city to support them and, as I say, use it as a framework for partners for when to refer to ourselves. And hopefully that supports appropriate referrals moving forward. Also within the report, we've got within the delivery plan where it focuses on where we are with the MASH, and the MASH continues to be embedded, continues to be support from an early stage. We've got a little bit of feedback that I'd just like to touch on from one of our partners in South Yorkshire Police. So in 1.11.2 in the update, we've got South Yorkshire Police have said to us, having a person from each agency at the huddles provides the best means of navigating the agency, using knowledge of who to direct any queries to get things done. This speeds things up and is a great feature. For example, recently a high-risk missing person with a variety of additional needs was discussed at the huddles, and this resulted in all involved in his care attending and providing a bespoke support package, allowing him to return home. So that's just one example, but yeah, there's a number that happen within MASH on a daily basis that support people across the city to live the life they want to live. The performance report as well, I think key highlight from that is when we're looking at the median timing for screening, we're at 1 day, so making sure that when them concerns do come into adult care and wellbeing, we're looking at them and we can prioritise to make sure that we are managing risk. And when we're looking at outcomes for people and how often we are meeting those, we're fully or partially meeting people's outcomes 94% of the time, so that remains high. So there's a lot of positive work I feel like we can report within this update where we're working towards those points within the delivery plan. Okay.
Thank you. Are there any questions? Councillor Sackwell.
If I could take you to the top of page 101, I'm just slightly concerned to see that there's been a significant increase in the reports of abuse from the mental health hospitals. Could you expand on what's occurring there, and is there any cause for concern that we need to look into further? Thank you.
It's in the commentary at the top of 101.
I think Alexis can come in there.
So it's in the commentary of the safeguarding plan. This will also go to the safeguarding board in April for discussion. And I think that highlights two things. Number one is probably some of the improvement work that's going on within the trust, but also the greater awareness of safeguarding. So there's a bit of, sometimes when you raise more issues, that also raise highlights. Equally, what I have also done in my own capacity is to ask the sort of assurances regards, what's underlying the concerns. And I've actually got a call with the executive director later on today to explore what these concerns are further, so that not only we could take them forward through our responsibilities in terms of safeguarding, but also to also give assurances to the safeguarding board as well that we're trying to ensure that people are safe.
So just to follow up, is this an issue within Sheffield Health and Social Care NHS Trust? Yeah. And we're looking at good, thank you.
Can I just add to that too? So since the mental health social workers came back into the council in 2023, those mental health social workers have been attending the mandatory training that we hold for the rest of our social work staff. So I think perhaps that indicates as well a greater understanding of what adult safeguarding is from the staff within mental health. And perhaps although it looks like the data has gone up and there's been an increase, as I say, I think it shows perhaps a greater understanding and more work we're doing within Sheffield to support people with mental health needs and to keep people safe.
Thank you. So there are recommendations with this report. They are on page 52 of your pack. And they are endorse progress made with implementing the adult care and wellbeing safeguarding delivery plan and the accompanying performance report. Endorse the safeguarding responsibility guidance document produced following the draft being endorsed a committee in September 23, and request that the strategic director of health and wellbeing continues to provide the committee with updates on progress against the delivery plan on a 6-monthly basis. Are members happy to approve those? Excellent. So we move on to item 10 on the agenda, which is, thank you very much to Dawn and Andrew. Item 10 on the agenda, which is occupational therapy, equipment and adapted housing and citywide care alarm and technology enabled care update. Lots of things in there. Kelly.
Thank you. Good morning, everybody. My name is Kelly Siddons and I'm the Assistant Director for Living and Ageing Well Short-Term Services. So I'm here today to talk to you about the report that's focusing on occupational therapy, equipment, adapted housing and technology-enabled care services and provision. We are bringing to you today an update on the delivery plans that have previously been brought to committee, and the report also details some of the activity that's currently underway that's helping us to move towards a more robust provision that's responsive and accessible for the people of Sheffield. So, linked to a number of other things that we've already spoken about actually this morning, it's really clear that it was really important to bring these reports together. By bringing them together, we can deliver you a more cohesive approach towards our aim to reduce, prevent and delay needs, which again is also about improving outcomes for people and also reducing reliance on more formal services wherever possible. So our first focus really is about promoting independence, as in line with the Care Act, and our technology-enabled care and adaptations and occupational therapy is all a key measure in allowing us to be able to do that. So we've previously set out our early help delivery plan and our technology-enabled care market shaping statements, and been really clear as well on what our priorities are about improving the delivery of these services to people in Sheffield. So some of the progress that we've made in particular is highlighted in this report. So I'm going to focus first of all on the integrated community equipment loan services. And so the loan service actually procures, stores, orders equipment, distributes across Sheffield. It's quite a sizable service in that we've got at the moment 1,707 people currently prescribing equipment, and that's from across all of our organisations through health, social care, and we've also developed more recently some trusted assessors. What we know at the moment is that we're currently undertaking a review of this contract. So the contract was initially launched in March 2020 and is due to expire on the 1st of October 2025. We do have an option to extend that. But the work that we're doing at the moment is actually in partnership with our colleagues in the ICB, and that's about looking at how we're providing the service at the moment to ensure that it's delivering the best possible outcomes for people, that it's responsive, and that it's also supporting things like hospital discharge and our strive to reduce, prevent and delay needs for people. So the leadership for the review will be delivered by myself and also through our new principal occupational therapist. I was quite kind today because she is in the room, but she's only been in post a week, so I've not dragged her up. But Amanda Greenhalgh's joined us in the last week as principal occupational therapist and will play a key role in the review of this service delivery, working with people. So the next point of the report actually focus on the use of the Disabled Facilities Grant and adapted housing in Sheffield. So we know that equipment and adaptations, again, is key about supporting people to live independently and to remain well in their own homes. And over the last 12 months alone, the service has approved 354 adaptation grants, and we've actually delivered 701 adaptations. So again, looking at the work that we're doing through our DFG grant, it was really important that actually we developed a really robust standard operating procedure, which we've now done. So we have a clear governance system in place that enables us to distribute the grants formally in line with the legislation, and where adaptations exceed the total amount, so it's £30,000 for the DFG grant with the option for £20,000 discretionary fund. Any of those now exceeding the 50,000 are subject to approval by our strategic director. That process is really helping us to monitor our spend against the DFG, but also actually really making sure that we're using best value for money in Sheffield. The standard operating procedure, as I've said, sets out really clear definitions as well around the discretionary grant and how we use that. And we'll be bringing updates to committee with regards to particularly the spend around DFG every 6 months. In addition to the standard operating procedure, one of the other things that we've actually focused on through our occupational therapy services is the development of the eligibility criteria for equipment and adaptations. So we've undertaken a review of the policy that was in place, reviewed it again against the eligibility of the Care Act requirements, and we've changed some of the wording to be more inclusive rather than exclusive, and also again to take a more preventative and early intervention approach, really focused on the person and to be more person-centred. So again, a key step around all of this work will be working with our new principal occupational therapist to work with the people in Sheffield that are living with a disability and their carers to make sure that our criteria and approaches are inclusive and person-centred. So therefore, one of the asks of today is that you would look at Appendix 2 and consider approving that, so that we can look then towards implementing that during the period of March to October of this year. We've got a number of sessions that are planned with our current workforce, and we will, ideally we'd like to take that forward with them so that we can be really clear on getting that implemented and in place. So the guidance is really about just being consistent and fair with our approach as well, and we've taken some lessons learned where, we've looked at previous history and some of the outcomes that we've delivered with people in Sheffield. So from an occupational therapy point of view, again, we've done lots of work within this service, and we've got our service manager for this area has been really actively working with people and with the service itself to produce a leaflet that kind of sets out really clearly what the service does, what people can expect from us, and also, again, a real move towards being really proactive and taking a preventative approach. We do know that this service did have quite a considerable waiting list previously, of which we've managed to reduce those numbers down. However, this is against a backdrop of an increase in amount of referrals that the service is receiving. So it is a really difficult time, but actually quite a lot of positiveness around the service. The staff are really keen to change, test out new things, and really look at how we can reduce the demand within that service area. So actually really quite excited about the development of that service in the next 12 months. So we have reduced the numbers of people waiting to around 1,100 at the moment, but we've got a number of actions that we've put in place that are coming on board in the next few months that we think, again, will have a positive impact. So we're launching an assessment clinic in May 2024 where we will invite people in, and actually that can be a really positive move. We've looked at evidence that's been used elsewhere about the impacts that can have. So again, that will allow us to see more people over a shorter space of time, but also gives people the opportunity to be able to test out different pieces of equipment that perhaps we can't do if we are looking at somebody whilst they're in their own environment. We're also considering, within that same setting, developing the use of an independent living centre. So it's not just about the aids and adaptations, it's about how we can showcase the equipment that we've got available to us. So all that will be part of that ongoing development and the further work that we're doing around trusted assessors with our existing workforce in Sheffield. So all of this will just help us to create a more sustainable workforce and continue to meet the increasing demand that we're seeing through our services. The next section actually looks at our citywide care alarm service. Again, quite a lot of work being done through this service. We know at the minute we've got over 8,000 customers in this service area. Our staff work across the city and do an excellent job as well. And I know some of our local councillors have spent some time with this service, so that was great to see. The service has developed more recently an innovative project with the Yorkshire Ambulance Service, and this is about the support to people that are classed as an uninjured faller. So it reduces conveyance into hospital, but actually also, whilst it's reducing pressure on ambulances, it's also supporting people to remain at home, where they don't necessarily need to go through our A&E department. So the work that we've been doing around that has actually been held up as really good practice. So we've spoke recently and we've included a presentation in here that we've just delivered at one of our Better Care Fund events recently. So this work is actually being looked at by lots of other local authorities to see if it's something that other people would like to introduce. So at month 9, citywide care alarms did have a 0.5 million pressure. This was the result of a combination of DFG funding availability reducing, but also as we transfer from analogue to digital, I think that's also had an impact on the cost of the equipment that this service are having to purchase. But the main priority is just keeping people safe and working with people during that transition period. And then the final section is around our tech-enabled care services, which again is a really exciting area and brings into fruition all the technology that we've got available to us. We've previously set out the Health and Social Care Digital Strategy Plan, and we've had a number of really successful events where people have been engaged to and looking at some of the technology that is now on the market. I'm pleased to say that we are testing out some of that equipment, and it's showing some really good outcomes for people. So it's really person-centred. So just highlighting in around the tech-enabled care is that this is also going to be a real part of our new care and wellbeing service. So we'll be encouraging external providers to tap into this equipment. So again, it can reduce the dependency on more formal services where it's not as necessary. So it can use all sorts of different things like GPS. There's some amazing technology out there at the moment that we're really keen that we embrace and make the most use of. We are developing all sorts of things with our partners at the university. So we've got a really exciting opportunity to have a flat that's there, and that's starting to show the outcomes that actually we're going to be able to use through our research. And that's a really quick whistle-stop tour. We've rolled it into one, but there's lots of information in there. And I just hope that you can see that actually by bringing that all together, it's about working together better collectively as those work streams.
Thank you. I love the enthusiasm, Kelly. Now that you've been in post a bit longer, you know, everything that's going on. Thank you so much. Before I take questions, I have a question. Sorry, I'm going to take chair prerogative because I'll forget otherwise. I was just wondering, in terms of, particularly of adaptation, in terms of adaptations, what are we doing to ensure that we cater for people from different communities, in particular when language is a barrier? And I do quite a lot of casework with, you know, people in my ward where I have to use an interpreter when they have, you know, medical needs and need adaptations, but they don't have that kind of outlet because the information might get garbled or they're not being listened to. And it's not, you know, it's not council housing, it's like, you know, other providers. And I wonder how we are going to ensure that we kind of consult with people from different communities. We've got an elderly population, you know, like any other place in the country, but also we have elderly people whose English may not be, you know, very good or as good.
Yeah.
So how are we going to ensure that we don't we don't prejudice people's outcome because of their language barrier in particular?
Yep. So there's a couple of things there for me. I think first of all, there's something about cultural awareness and understanding people's needs with regards to their culture. So we do take that into consideration as part of our occupational therapy assessment. So that's some of the work that we'll be doing with our principal OT to make sure that that's, you know, done well and recorded, and that we're really clear on the outcomes that people want around their cultural needs. And then I think the other thing is about communication and making sure that that's accessible and that it's, you know, all encompassing to everybody. We have got access to a new system that's just coming online as a local authority where we've got much more timely access to interpreters. But I think it's also about making sure that we engage with families, carers, communities. So particularly the work that we're doing with our local area communities at the moment to understand the challenges within each of those areas will be particularly helpful.
I think Councillor Sapwell wants to come.
I mean, the first thing to say is more of a comment. Thank you for continuing to take into account our concerns about the use of more remote consultations and the lack of personability. It sounds like you're on that and making sure that the person's not forgotten in all of this, so thank you for that. The second thing is to follow on from Councillor Argentia's point on an equalities level. What impact assessment has been done to ensure that those who live in kind of technological poverty aren't left behind in this? Because not everyone has an internet connection, not everyone has a smartphone.
Yeah, I think it's really important to recognise that, that is very real for some people. We have actually just been having a conversation about the different formats of technology that are available. And we had a conversation with somebody last week, just simple things like, not everybody has a smartphone, not just an internet connection. So whilst we provide a lot of our information available online, How do we get that information out to people that have not got access to, you know, a smartphone or a laptop and such? So there is still something about the traditional use of communication and making sure that we've still got paper and, you know, just to have a conversation with people. But I think what will be really important is that first telephone call and that first point of contact. So finding out at that stage whether or not we are able to communicate with people well, what is their preferred method of communication. If people do have access to a smartphone, actually it can be really helpful to switch to a video call at that point in time. But where that's not possible, then obviously we will adjust our approach according to each individual. I think it's just quite reflective of how we want to work in social care anyway, about being really person-centred. But I do think there is something that we need to consider around how we promote technology.
And just to follow up on that, you were mentioning some kind of new technologies that might be able to help people. How do we ensure that, you know, the most vulnerable who don't have access to internet maybe don't get left behind when other people are having access to new technologies, new devices?
Yeah, I think all of that will be part of our strategy, and I think it will all be directly related to the equipment that we're looking to provide into those homes. So within a lot of the equipment that we're using, it's got a built-in SIM card that's part of that offer. So there are plenty of solutions out there for people that are perhaps not in a position to already have their own technology in place.
Great. So there are some recommendations with this report. They are on page 122 of your packs. The first one is note the planned reviews of the integrated equipment loan services and adapted housing to take place during 24 and 24-25. Approve the updated equipment and adaptation criteria at Appendix 1. Notes the update on the delivery of the Council's occupational therapy and citywide care alarm services, including development of the falls prevention service as a partnership with Yorkshire Ambulance Service. Note the progress in delivering technology-enabled care ambitions, and request that the Strategic Director of Adult Care and Wellbeing provides the committee with updates and progress and outcomes in relation to performance and financial spend on a 6-monthly basis. Are we all happy to approve those? Thank you very much. Thanks, Kelly. And we're going on to item 11, which is an update on the carers delivery plan, which will be presented by Janet Kerr. I'm expecting a story, Janet.
Well, it's interesting because today Lee's done a script for me. The story about this one is, I'm the lead on carers, but sometimes I feel a bit like a ventriloquist dummy. I open my mouth and Lee's words come out. So that's how we operate, because he's incredible, the things he writes. And so I wasn't expecting this at all, but day before yesterday, I think Lee sent me a script, which I hadn't asked for, but he gave me. But I was very grateful. And having read Lee's words, I'm not going to use my own, I'm going to use Lee's.
It's good to be prepared.
Yeah, very good to be prepared. He did the same. I don't know if you remember the big event at the Winter Gardens, the big carers thing, and I was doing something at the beginning to open it. So I was going to say something, and then just before, Lee gave me what I was going to say. So it's... I'm not going to sit on his knee. That would be really inappropriate.
Sorry, where does that one go?
Can I help?
Yeah, come on. Yeah,
I'm not the best.
We're just having a bit of a equipment fiddling about, so I think we're ready now, aren't we? Brilliant. Take it away.
Right. So before we start...
Introduce yourselves for other people. So
Too friendly, aren't we? My name's Janet Kerr. I'm the Operations Director for Adult Care.
And with a focus on support services for unpaid carers.
Thank you. So, before we talk about the committee report, I'd like to start with a quotation from an unpaid carer. It's in the report, but it's worth repeating as it captures the essence of what we're trying to do with the carers delivery plan. And that quotation is, "Some people can shout and make others understand what they need. Others find that hard. None of us ever thought we would be carers. That's our job. Just make sure you are all doing yours right for people like me," which I think is really important, quote from a carer. So we've come to committee today to provide an update on the Carers Delivery Plan 2022-25, which was approved by this committee in December 2022. The report for today has 4 recommendations: to recognise the progress we have made with the Carers Delivery Plan, reaffirm our commitment to unpaid carers, which includes the strategic director bringing a report to committee setting out how we will become a carer-friendly city, acknowledge the future actions the delivery plan aims to complete, and request the strategic director of adult care and wellbeing brings updates to committee every 6 months to provide assurance on progress of the delivery plan. To briefly recap, the Carers Delivery Plan is how we make our young carer, parent and adult carer strategy vision a reality. Carers want action, not just the status quo, and the delivery plan makes it clear to carers what we are doing to help them live the life they want to live. We know that together we get things done, and the delivery plan embodies this council value. The delivery plan is multi-agency with key partners such as Sheffield Teaching Hospitals, Sheffield Integrated Care Board, Sheffield Health and Social Care Trust, Sheffield Young Carers and Sheffield Carers Centre, all making amazing contributions. There are many important reasons that we need to help our carers. Carers provide essential support to some of the most vulnerable people in our society. We need to be proactive and respond to carers' needs, or we risk compromising the health and well-being of carers and in turn the health and well-being of the person for whom they care. Carers are vital to our communities, and without this unpaid workforce, our health and social care system would be severely compromised. There are approximately 60,000 carers and 7,000 young carers in Sheffield, and with an ageing population, unpaid carers will be even more important in the future. This is why we need to focus on supporting carers, including preventing, reducing and delaying their needs for support. Caring can be incredibly rewarding, but for some, there are real difficulties. For example, we know that caring is a social detriment of health. Caring can increase financial hardship, with as many as 8,000 carers living in poverty in Sheffield, and caring can negatively impact educational attainment and life chances for young people. Supporting our carers via the delivery plan makes moral, ethical, legal and economic sense for us as a city. In short, we know in the last 12 months that the Carers Delivery Plan has positively impacted the lives of carers, but there is still much more to do. So now Lee's going to talk about some key highlights from the delivery plan over the last 12 months.
So to start, Sheffield had its first ever Carers Roadshow in October 2023. At the roadshow, there were 33 support organisations there. 1,728 contacts happened between carers and those support organisations. 2,041 pieces of information were given out at the roadshow, so it was really useful. 100% of carers surveyed said that the roadshow helped them to feel valued and supported. We've launched the Carer Strategy Implementation Group. This is a multi-agency group that oversees and adds to the delivery plan, and carers are involved in that. We've had young carers and adult carers come and help us shape some of those actions. The Council's adult social care outcome framework scores have improved in 4 out of 5 measures, including the quality of life score. So in spite of the cost of living crisis and post-pandemic, carers are reporting that their quality of life is improving, which I think is brilliant. Sheffield Carers Centre have created their involvement network. They now have around 100 people who are active in helping or shape services across health and social care. Sheffield Teaching Hospitals have created a carer's passport. This provides support to the carer while their loved one is in hospital. over the next 12 months, some of the things that we want to do, we want to identify even more carers, reach into more diverse communities via the local area committees and our roadshows, which we're wanting to take out into communities. We want to review the governance and membership of the Carer Strategy Implementation Group. That group has expanded quite a bit, so we just need to think about governance and what the next steps are for that. But it's organically grown, which is no bad thing. Signed the Young Carers Covenant. That's a Carers Trust thing that was launched recently and has 10 outcome areas that essentially we say we want to achieve. Sign No Wrong Doors, which is a memorandum of understanding between children's services and adult services, and they talk about how they're going to coordinate together to support young carers more effectively. Ensure that more carers get added to our Young Carers Register, and complete the Carer Centre's carer strategy. They're doing their own strategy, which is obviously informed by the broader strategy, but they want an organisational one as well to shape how they work. So I think essentially what we're trying to say is that carers continue to be at the heart of what we're doing, and the delivery plan will continue to take action for our carers, and we do have indicators suggesting that carers are feeling better about things in Sheffield, which is amazing. Thank you.
Are there any questions? Thank you. Oh, sorry, Councillor Thornton.
Sorry, thank you, Chair. Thank you for this. It's a really largely positive report. It's obvious that there's so much more that we need to do to support our carers across the city, and the work that's ongoing and how consultative it is really, really brilliant to see. So firstly, thank you. Obviously we need to do a lot more to support carers and young carers. So it is disappointing that we didn't see other groups back us our proposals for a young carers bus pass budget, but that is where we are. We'll keep proposing it as we think it's the right thing to do, and I don't expect you to address that as it is a political point, really. I have a little bit of a question which reflects from page 177, just as the figures that surround that self-neglect are on the increase, where carers have reflected how they're feeling. Obviously, we've got loads of things ongoing with groups like the Young Carers Forum, but it would be good to see this as a theme going forward to prioritise in focus groups and roadshows going forward, etc., just to make sure that we are addressing this. And I suppose it's just to ask as a question, if the delivery plan is all on track, as it largely is, then why are we seeing this decline in these key measures? I appreciate there'll be external pressure from the cost of living crisis, for example, but I'd hope that we're not missing something within the plan itself.
No, I hope not. And I think that's why I highlighted the Young Carer Covenant and the Memorandum of Understanding, No Wrong Doors, because I think there is still work to be done with young carers. I think in general, we're trending up. We're doing a lot of good work, but I think certainly on the adult side, Sheffield was in a very bad position when I first started. That was 10 years ago. We were pretty much bottom for a lot of measures in Yorkshire and Humber. We're slowly working our way up, and we've overtaken some other local authorities. I think we're now higher than Leeds for quality of life score, for example, with the ASCOF measure. So, yeah, except that there is still a lot of work to be done, and I think the carer agenda is often one that's overlooked. So I think it's important that that we all try and highlight carers and young carers wherever we can in the various meetings that we go to, and in various policies and agendas and things like that. So, and I think that is also something that has improved. I think it feels like there's a lot of momentum now with carers, and I think there's a lot of recognition around the value that they add. So, yeah, like I said, I think it's a position where the general direction of travel is really good, but there is still more to be done, so we can't be complacent.
Yeah, we put a lot of effort into recognising carers, and because I think sometimes it's difficult. I mean, we had a recent event at the Cutlers Hall. Angela was there, and I did a few minutes around unpaid carers. I mean, telling my story about my experience. It was before I worked in adult care of being a carer, and it's only now I look back and think I was a carer. I didn't think it then. So we're pushing that, and so what we're getting is an increase in referrals to the carers centre, which then is another issue because the carers centre are getting more work. But I think for this year we've really decided to make sure that at every opportunity we talk about young carers, because I think they can be a bit invisible. And so that is a lot of what we're doing. What we'll do in June, there's a Carers Week in June, and what we've been doing the last couple of years is having events usually it's the Carers Centre, but I think what we'll do this year is we'll do what we normally do with the Carers Centre, but have a focus on young carers as well, because I think that is and I'll just give a plug as well that there's currently an art exhibition at Weston Park which young carers have been involved in. I went to the opening of that, so if people are near Weston Park they might want to pop in and look at the artwork.
Thank you. Thank you for the report and thank you for the question, Sophie. Yeah, and again, from my point of view, is how carers recognise themselves in different communities, because some communities, they don't see themselves as carers at all. That's their kind of role, you know, looking after each other. So I think that's really important. And, you know, the fact that we will want to become a carer-friendly city will hopefully mean that this is high up on the agenda and we bring it back regularly, and certainly we will plug it in other areas of the council as well. So thank you very much. So the recommendations are on page 164 of your pack. I will not read them again because Janet very kindly mentioned them all at the beginning. Are people happy to take the recommendations? Thank you very much, and thank you very much for the report. And we move on to item 12, which is the Adult Care Strategy Delivery and Service Performance Update. Thank you, Catherine. And Rebecca, do you want to introduce yourself properly with your titles?
I'm Rebecca Dixon. I'm the Service Manager for Care Governance and Improvement.
Hi, I'm Catherine Bunting. I'm the Assistant Director for Commissioning and Partnerships.
So this report is the Adult Health and Social Care Strategy Delivery Plan and Performance Update. It's the quarterly overview of performance and strategy activity, which follows on from the report you had in December 2023. This report, I think, is very much focused on the delivery of outcomes and working in genuine partnership with individuals, carers, those with lived experience, partners, etc. And the report pulls out several elements of that. So just to give you a few of the highlights, we had our Adult Social Care Conference on the 20th of February, which over 200 staff attended, and that was focused purely on promoting and building partnerships and collaboration, which is something we want to continue to embed. And critically at that event, we had a number of partners, both from the statutory sectors and the voluntary and community sectors, who were part of those presentations and those workshops. We've appointed 2 co-chairs from the autistic community to be our ambassadors and leaders working with the Autism Partnership. And our Changing Futures programme has co-production as a key priority. People with lived experience are called co-production associates, and they're actually now part of a national co-production network informing priorities in central government. The next big section within the report is our preparations for our CQC inspection in adult social care. And again, this is very much on the self-assessment. We're now in the consultation period of the self-assessment, And I think key to that is it's really important to us that it's not a management document. The self-assessment needs to fully reflect the views and experiences of people who use and access services alongside our partners and our workforce. And that's because we want to give a true narrative to CQC, which helps to drive forward improvements and also enable accountability for the people who use and access our services. So as part of our want to be open and transparent with the self-assessment, it is about to be on the council website and also have your say, the digital council consultation platform, alongside active staff engagement to make sure we really do have a narrative that resonates the views and experiences of people who use our services and work on the ground. The next part of the report is the adult care performance and quality update, highlights from the monthly dashboards. Overall, a very positive position and direction of travel. So again, just to give you a few of those highlights, in terms of early help and prevention, RI statements show a positive trajectory, and the percentage of people receiving support from first contact continues to be reduced. We have a continued reduction in waiting times for reviews. In terms of care and commissioning for older people, 8 out of 10 of our commissioned providers are good or excellent, and 85% of people who use these services feel that they made them feel safe and secure. Continuing to increase our support to unpaid carers, 76% more referrals to the carers centre. In terms of hospital discharge, we have minimal waits for home support needed on discharge, including somewhere to assess and residential care beds. And Sheffield overall discharges more people home than regional and peer comparators. And then Catherine's going to talk to you about the strategy.
So the focus in the coming months is to do a stock take and review the progress made with our strategy delivery plan since autumn 2023. We're doing that in an engaging way, a live way, through workshops and getting engagement from our partners and from people in Sheffield. That will allow us to bring together our CQC assessment and readiness, our aims, our ambitions and our performance all together. And there's a series of workshops that are outlined in the report really for you, where we hope to do that in a meaningful way that encourages discussion, conversation, and for all our partners to understand the contributions that they make to delivering our strategy and feel some ownership about it.
Are there any questions from members? Okay, I'm going to thank you for the report. And can we look at the recommendation there on page 200 of your packs? So it's recommended that the policy committee notes the progress in delivering upon the adult care strategy, Living the Life You Want to Live, notes the adult care and wellbeing performance at February 2024 in relation to each of the adult care and wellbeing priorities and our actions in response, and notes the planned consultation and engagement on the CQC self-assessment and our preparations. Brilliant. Everybody in agreement? Fab. And thank you so much. And we move on to item 13, which is the adult care and wellbeing providing support market sustainability and commissioning plan for 2023 to 25. And we have some guests, don't we?
We do have guests, yes. I'm still Catherine Bunting, and I'm still the Assistant Director for Commissioning and Partnerships. This is a great opportunity, actually, and we've been talking for a while about having a sort of collaborative presentation to committee from a commissioning perspective, which is something we really want to be as a service. So I'll let Leroy and Sharon introduce themselves.
Oh, hi everybody, I'm Sharon Lowry, I'm the Chief Executive of Be Caring. We're an employee-owned social enterprise delivering care in the north of England, and we're one of the new providers started to deliver in Sheffield in the coming months.
Yeah, hi everybody, my name is Leroy Young. I work at Silver Healthcare in Sheffield. We're a family care home company. We've been here for about 30 years. We've got 2 small care homes in Sheffield. And we work with Catherine, and we come to meetings and we coordinate and we all pull together, and that's me. Thank you.
So I'm going to try and do this in a timely fashion and smoothly. So this report, it follows the format of previous commissioning updates to committee, where we provide information on the activities that we've undertaken in the last few months, as well as our priorities going forward, to ensure that we continue to secure markets and services in Sheffield that are sufficient, stable, high quality and value for money. In this report, I'd like to draw attention to the ongoing partnership approach that we're continuing to build, and that's outlined in paragraph 2.3. There's ongoing work in our adult future options strategy, which is detailed in paragraphs around 2.5. And then I'm going to go backwards a little bit. I'm going to start with saying at the end of paragraph 2.3, we mentioned the new care and wellbeing service, and there's an appendix attached to the report which provides an overview of our home care commissioning strategy and the implementation of this new contract, which is transformational for Sheffield. It's really about putting outcomes and quality of care at the centre of home care provision and supporting our providers and our workforce to have that trust and have that ability to be able to do that themselves. We're in the mobilisation period right now, and it's a clear priority for the commissioning team, and we're reorganising our resources and our workforce to be able to do that successfully. And if it's okay, Sharon, I'll pass over to you now just to talk a little bit about what you hope to bring.
Oh, thank you so much, Catherine. So as an employee-owned social enterprise, we don't have any shareholders, we don't have any debt, so it means every penny that is invested into Sheffield, we can invest in our workforce and in the care that we deliver. So I came into home care about 6 years ago now, and I was slightly horrified about how we valued our care workers. The fact that they didn't have guaranteed income, you know, some of the people that they would support would go into hospital and their income would stop. So 0 hours contracts was the only option for many providers. So what we will bring to the table is guaranteed hours, carers valued, empowered to make a difference, not worried about how many hours of care have I got on my rota, knowing they're out at work, empowered to make a difference, to be responsive. Our carers see the most vulnerable people in our communities more than anybody else, and they know these people, they know when they're a bit lonely, they know when they're a bit down, and that there's so much more we can do than the traditional medication morning lunch. And so to give you a little bit more confidence, we have tried and tested this model in many cities across the north of England, and we're quite particular about which contracts we tender for. So it was hugely exciting to see this and build the relationships with Alexis and her team. So yeah, in a nutshell, it's about valuing the care workers, empowering them to be responsive to the people they support, guaranteed income, guaranteed hours, paid full time for their training, nothing to do with minute by minute billing or invoicing or paying carers that way. So, and what we found is we do keep people out of hospital. We're not escalating packages where they're needing more and more, because we're valuing care workers, and they're staying because they enjoy their role. They feel part of something. They build those relationships with the people they support, and it just makes such a difference. So yeah, very excited to come to Sheffield.
Thank you. And we've got a number of briefings for members as we go through the mobilisation period, as well as sessions for people in receipt of care and the workforce that will certainly continue as we're in the mobilisation period, but also after, as we continue to try to deliver on that ambition. I'm now going to combine paragraphs 2.4, which talk about our transforming care homes commissioning strategy, and section 4, which is about the fair cost of care and our trajectory towards that. So we've done a lot of work in conversation with providers, in partnership with Healthwatch, to get the voice of people who are living in accommodation with care, to develop a new specification for standard care homes in the city and support our providers onto a framework so we've got better and a stronger contractual position, as well as starting to look at the needs of Sheffield in the future and how we work together to develop that and deliver that and focus on outcomes and personalisation. That contract is now live and has gone live since my last report here. We're really delighted with the response that we've got, and we'll continue to promote that with care homes in the city. connected to that work is making sure that we're paying a fair cost of care for people who are purchasing care and a fair cost of care for the people delivering it. At section 4, we do note the progress that we've made. It focuses very much in this report on standard care homes. Of course, it's a conversation that covers all of adult social care provision. And committee will be pleased to know, I'm sure, that we've purchased Care Cubed as a software which will allow us to continue to understand the cost of delivering care in Sheffield for different providers, including nursing provision, supported living, day activities and other services. And we're going to promote that through this year. And we also talk in paragraph 4.12 about the future work we want to do to keep making sure that we're getting value for money and that providers are supported to deliver high quality care. So we have closed the gap in Sheffield. We've really made an effort to do that over the last 2 years since our first fair cost of care exercise was done. And we're having ongoing conversations with the sector about the ongoing pressures that they face. And if it's okay, Leroy, I'll pass over to you to just highlight from your perspective what the work's been like.
I think one of the biggest challenges for us is it's the staffing, it's the recruitment and retention on a daily basis. It's planning the rotas, it's getting the staff in. It's really, really difficult when you can't get staff because you can't pay them any more than minimum wage. You get a job elsewhere for more money and they're not valued right. Our carers come to work, they work 12-hour shifts, they catch 2 buses, they work really, really hard and they deserve a lot more than minimum wage, and it's not fair. But we can't pay any more than minimum wage because the numbers don't stack. We need to get closer to the fair cost of care so we can start to improve the terms and conditions for staff. We can pay more money. That's a big challenge. I think one of the other things that somebody mentioned earlier is about the IT and the tech as well. Everything's moving forward at such a pace that care homes and providers are struggling to keep pace with that, the expertise, the cost of that. So I think that's a massive pressure on care homes as well. I'm talking about electronic care planning, talking about electronic governance and compliance, electronic staffing rota, that kind of thing. All that comes with all different subscriptions and different providers, and it's overwhelming when you start to look into it and try and do it. And it kind of always keeps coming back to what we're receiving to do the job, and it's difficult to make it all stack up. So there's a lot of pressure.
And on some of those conversations, so Leroy's been really supportive with us in having conversations with care homes, and we've done a bit of work to understand what moving towards the foundation living wage would cost our providers, and we think that's probably around £20 to £30 cost implication. That obviously though brings with it better staff retention and better career prospects, and we were talking earlier, weren't we, Leroy, about actually the cost of recruitment being significant. So those costs go down the more staff retention you've got, so it's a win-win situation for us both as partners to move towards that. And we've also talked about the condition of buildings and the importance of us working together to try and seek investment into Sheffield homes, into that infrastructure, because more energy efficient homes and buildings cost less. I think we're all happy to take questions.
Any questions? Councillor Milson.
Thank you, Chair, and thank you for the report. I want to congratulate really the work that's been done on pushing so hard on achieving the transformation of home care. So referring back for those who weren't there or don't know, in June 22, the Council adopted the GMB Union's Ethical Care Charter, and the home care commissioning, moving from time and task to block commissioning, is an absolutely key part of that, isn't it? So for me, that's really couldn't be more welcome to see us reach that stage of actually rolling that out. So I'm really happy about that, and it hopefully provides the stability of carers being paid for all of their time, and being committed to the block of care rather than hopping from job to job, and discouraging the non-payment of downtime. You're nodding, so that's really good. So it creates a more valued and sustainable workforce, which I think is really where we wanted to get to. So that's brilliant. The GMB Charter does make some other asks as well, so I just wanted to sort of checklist those and see where we're at. Not necessarily expecting everything to be answered today, but I just wanted to flag up really the other parts of the Charter. So paying the going rate and working towards better retention of staff. And the Charter then, it's nearly 2 years ago, mentioned £15 an hour as a desirable target, and that obviously needs adjusting for now, but I know we're on that trajectory, and I know how hard it is to reach that. So again, sort of thanks for the work, and let's keep going on that. I'm assuming we're not quite there yet. And training, and of course we're setting up the Skills Academy, the Carers Academy, which is also a target in the GMB Charter, so that's really good to see that fulfilled as well. And then the Charter does talk also about social value, and about how councils should recognise social value and assess how all of their listed preferred providers contribute to the social value of those who deliver the care to clients, as well as the value the service has for those clients, as quoting from the Charter. I think we're on the path to that as well with the home care commissioning, because with the locality-based delivery, that should add a lot of social value to the care that's delivered. We've talked about carers working in neighbourhoods and therefore understanding the place that the person receiving the care lives in, and being able to signpost them to things in that community and create more of a sense of community in home care. So I think that's really good. But I just wanted to sort of flag those things up as maybe ongoing in the work that we're trying to achieve, and let's kind of keep going with the Charter and keep the work up to meet the objectives. The final one is about whether all our providers recognise trade unions and have formal agreements in place that evidence that. How do our providers consult with their workforce? So more detailed questions like that. And then at the commissioning body, which is us, the partners coming together to review home care delivery in communities. So that should be with a view to continual improvement. And it is suggested that might include home care providers, trade unions recognised within that area of delivery, councillors and MPs and commissioning officers regularly meeting together to review how care delivery is going. So I think the mention of trade unions and MPs there, as well as involving home care providers directly, is perhaps something we're not quite on top of yet. So just wanted to flag those things up. I've got a question as well, just about.
Can you just wrap it up though?
Yeah, I just want to as well just reiterate that quite several members on the committee have flagged up before the issue of profitability in the private sector, and I know Leroy's sitting here now, and we've heard your story, Leroy, about as a small provider how you're not in the same league as the big investor shareholder providers. And just I noticed in the report we talk about value for money, and we're talking about an exercise to assess reasonable profit later in the year. And all my colleagues are nodding because we've all talked about it, haven't we? And so I can't wait for that exercise to happen and see what the upshot is and how much influence we can have as a council on how that profitability is handled in the sector. Thanks.
Councillor Mesmer, I think Catherine is going to have a go, and then Alexis is going to come in as well.
Yeah, thank you for all of those comments. I think on the GMB Charter, yeah, we sort of collect and ask providers for information against that regularly, including rates of pay, ensuring in the case of home care that where those rates of pay include travel, we make adjustments to understand what the true rate of pay that people are getting are. I think the key thing that really should provide assurance to your wider comments is that we're moving from a competitive contractual arrangement to a collaborative one, which sees us all working together, sharing best practice and moving forward to the value and improved outcomes for people in the city. And I think we'll come back in more detail, of course, but I'm very hopeful that that will address all of your comments there. On the question of profitability, yeah, we've put in that that workshop to look at that, to look at what it means. The Care Cubed and our software purchase allows us to keep monitoring that to make sure that it feels appropriate and fair to all.
Thank you very much for the question and insights, Councillor Wilson. And I think one of the things I just want to kind of highlight as part of this, as part of the evaluation and actually the work around the contract, we actually involved unions in the process. And I think we were one of the only local authorities to go and do that because we wanted to have that focus on our workforce from the very outset. And that's part of the transformational aspect of this new contract and Wellbeing. It's actually, this is about really valuing our care sector workforce. So that was one of the key things that we built in. And I think we're being held up as really good practice actually across England because we've involved unions and worked the ethical care charters. But equally, I think for me, and I'm going to say this maybe because I'm somebody who's actually started off as a 17-year-old as a home carer, and that's, you know, and it's been one of my key kind of passions actually over the last few years is to get really good care, is that I've always seen home care as more than care, exactly as Sharon spoke about earlier on. The social value that home care brings, particularly to communities, as they are community connectors. They are the people who will be in people's houses, supporting people, and actually do so much more than what is often talked about. And for me, one of the opportunities we've got in Sheffield is to really showcase that and to really become the community connectors across communities. And that is, you know, the transformational aspect that we are going to work towards, and everything and more that's in the ethical care charter that are around from all the unions is what we could what we are very ambitious about is achieving in Sheffield. And what my commitment is to do is we'll bring an update about how we are meeting all the charters, you know, to committee as part of our mobilisation and implementation of our transformation of care in the city.
Thank you. May I suggest that maybe we work it into the work programme to see when it's appropriate to bring it back so we don't forget. So John, if you can make note of that, we're going to look at that item for the work programme and drop it in. Councillor Phipps wants to come in.
Thank you, Chair. I just wanted to say thank you for this piece of work. It feels like we are moving the right way on this. I've been on this committee or committees to do with health and adult social care for a long time now, and it feels like when I first joined there wasn't such an acknowledgement about the difference between what we were offering in terms of fees and costs and the actual cost that it takes. And I think we've moved to a position now where we are acknowledging that there is this gap and we need to be closing it, so that's really positive. And yeah, I just want to say I'm also looking forward to that review of profitability that Ruth mentioned. Oh, it's way too long for a morning. Yeah, I'm looking forward to that review of profitability as well. I think that'll be interesting. And I also just want to say specifically thank you to the officers for noting about the foundation living wage for carers. Carers do such an important job and deserve to be fairly paid for that. So just a general thanks for this.
I have Councillor Hurst. Sorry, I can't see you because I have... and can I just say Councillor Hurst and Councillor Sapwell? And then if there are any questions, you can address both.
Thank you, Chair. Sorry, I'm hiding behind the screen. I realise that. More a comment than a question. I just wanted to say thank you for this partnership piece of work, what feels like a genuine partnership piece of work, and I will be very interested in if I'm not on this committee next year, at least reading about it when the agendas are published, because it's something that's a long time in coming. Thank you.
The last few years have been totally different, completely different. The relationships that we've built over the last 2 years with Officer, with Alexis, with Catherine have been, you know, we've never seen it before, and that's what we've needed to kind of break them doors down and get to where we are. And thank you for your comments, because that is really important that the council's finally acknowledged the gap between it, because we've all been really struggling for the past 5-10 years, to tell the truth, and we're finally starting to get to where we need to be. So it's really encouraging to hear that. Thank you.
Thank you. That is really good to hear, actually. Not anecdotally, in person. It's brilliant. Councillor Sapper.
A slightly tangential point, but one that was mentioned earlier about buildings. Has our ability to to deliver care being affected at all by the rack concrete issues at all in large buildings? And are there more general building issues across the city with care placements that could be brought to attention for us to have a look at?
I might have to come back to you on that specific question.
Sorry, my mic there. It's a really good question, because I think that one of the issues for me is actually about the overall state in social care. So I'm going to answer this in a slightly different way. One of the things I see within the NHS is an estate plan for the NHS. There is no estate plan for social care. And that is something that actually has struck me quite a fair bit. And as we've got into the Transform our Care Homes agenda, and particularly discussions we've had with care home providers, is that's exactly what's needed, is an estate plan for care sector. Exactly the same as what's required for NHS. And so one of the key, work that we want to do is over the next, is described partially was in the report, is to work with providers to look, particularly to look at fuel efficiency, energy efficiency, and to look at different ways of working around the estate. But for me, there's also learning, I think, from, I'm going to be honest, from the NHS estate plans to how we could also take that into the care homes, particularly to the care home sector, and that will all inform the work around the fair cost of care. So that's where we've did that sort of milestones of kind of a timeline of work that we want to do over this next year to get underneath that. But it's a really, it's a really profound point, because actually, for social care to be valued at the same as, that's what we're doing, and what we're trying to do in Sheffield is be bold and brave and do this, basically.
Thank you. I'm going to take the last question from Councillor McLean.
Thank you. I'll be brief. I don't want to repeat what all the members have said today, but I just wanted to mention one of Leroy's care homes is in my ward, and I had the pleasure of visiting there and meeting with you last year. And it was clear to me to see just how much it has struggled with the gaps in the fair cost of care, and that was just evident to see. But what was also really evident and wonderful to see was sort of Leroy and his staff's commitment to both the residents in their care home, but also ensuring the best possible conditions for the carers and people that work there. So it's just really good to hear that partnership working that's happening between care providers and officers and members is sort of progressing, and it's just really good to hear that and have some positive news to end our year on. Thank you.
Thank you. Excellent. So there are 6 recommendations with this report. They are on page 220 of your packs. They are noted, so we need to note the trajectory towards the fair cost of care and proposal for future work, note the progress with commissioning programme and priorities for 24-25, note the market oversight and assurance position at year end and the establishment of a monetary advisory board, note the approach to engagement and partnership working with providers and voluntary community and faith sector, note that next commissioning update will focus on adult care and wellbeing quality assurance, and request that the Strategic Director of Adult Care and Wellbeing continues to bring regular updates to the Adult Health and Social Care Policy Committee. We're happy to approve those recommendations. Fantastic. Thank you so much, and thank you so much for coming, Leroy. And we are on item 14. This is the Adult Care Working with People Delivery Plan. I have 10 minutes for this report. And it's Janet who's going to present it.
Hello everyone, Janet Kerr, Operations Director. We may not need 10 minutes, and I'll explain why. So what the Working with People Delivery Plan is, it's basically the first section of the CQC assessment area. So what we've done, in order to focus our minds and our attention, we've created this report which will come back to you every 6 months, and where you'll be given an update on what progress we've made. So if you look at the report, it's basically a summary of things you'll have heard elsewhere. The very eagle-eyed might notice there are some same words that you might have already read this morning in the report that Lee wrote. And so and actually the work that Kelly was talking to you about, because we talk about OT in there. So basically what the working with people area is it's our bread and butter. It's what we do every day. But what we're doing in order to be really focused on what we need to do. So I mentioned CQC, and that's fine, because we know CQC will look at that. But one of the things I quite often say is CQC are not looking at anything that we shouldn't be doing well anyway. So if CQC weren't coming, we'd still want to be doing this work, and I think that is a really important point to make. So if you look at what I've covered, so we talk about weights, and that's weights in different teams for assessment, so social work and occupational therapy. We talk about reviews, and actually we've had a mention of reviews this morning when Jonathan was talking. It talks about direct payments and where we are in terms of direct, and I think it was last committee that you had a report on direct payments. It talks about carers, it talks about tech. So basically it's a way, I think, of us bringing all those things together in a helpful, focused manner to ensure that we're doing the right thing in terms of the people we work with and in terms of our preparation for CQC. So I'm quite happy to take any questions, but I think you've seen some of the numbers and figures and information before, so I don't want to labour any of that.
Are there any questions? Councillor Milson, briefly.
It's brief, don't worry. At 1.6 in the report, page 279 in our pack, performance clinics have been introduced and take place regularly, focusing on outcomes. Could you just really briefly describe what happens in a performance clinic, who's present, what's brought to the discussion, what the outcomes of the discussion might be?
Yeah, so the performance clinics are now at different levels. So we started originally, and it's something that Liam helpfully pulled together with some of the people he works with. So we would take an area, we would basically deep dive, look in detail about what we were doing, how we were managing that work, if we thought there was either information missing or that we weren't performing as we might be. So, and that was a really useful thing to do. We continue to do that on that level. But what's now happened is all the individual ADs do the same in their own area. So they're getting into even more of the detail that they might need to do. So, if it was, say if it was Joe Pass's area, there might be a focus on dementia. So it's about making sure, and I think the other important bit actually of the performance clinics, because we've involved a lot of people. You did ask me who's involved. So we would basically, when we were preparing for the performance clinics, we'd look and see who was relevant. So we'd have quite a, I mean, sometimes the people sitting there were, quite many and varied, because we wanted to make sure that we got as many people there who got a view and not miss any of those views. So I think there's been a really important way of getting the conversation started, identifying gaps, being clear actually about the things that we are doing well, and being able to say, right, actually they're an area of good practice, but then focusing on the things that we think we might be missing.
Thank you. There are two recommendations with this report. They're on page 278 of your packs, and they are notes the update to the Working with People delivery plan, and request that the Strategic Director of Adult Care and Wellbeing provides the committee with updates and progress against the delivery plan on a 6-monthly basis. Are we all happy with those? Fantastic. And we are on the last item on the agenda, which is item 15. Which is the 2023-24 Q3 budget monitoring. Thank you.
Thank you, Chair. I'm Jane Wilby, Head of Accounting. So the paper that you've got, item 15, is the Q3 budget monitoring update for 23-24. The full paper went to Finance Committee this Monday, and each of the policy committees gets an abridged version of the paper with the detail of the committee's budgets. So at Q3, the overall council position is forecasting an overspend of 16.7 million against net revenue budget of 493 million, which is a variance of 3.4%. Between the quarters, we reported a overspend position of 17.4 million at Q2, so there's been an improvement of 700,000 between the quarters. But there was a large movement in education, children and families, 2.3 million further overspend due to increased placement costs, risk of income in-house provision at Aldine House, plus a further £500,000 for home to school transport for SEN pupils. We have offset some of those overspends by drawing down additional income in adult services, underspends in youth services, improvements in commercial property, and further interest income from our cash investments. So the three main areas of overspend for the council, as consistent throughout the year, have been adult social care, children's social care, and in homelessness. So in children's, we're seeing huge challenges from rising placement costs and limited supply of carers in the city to support the demand. We've also got huge costs in home to school transport. Homelessness has arisen post-lockdown, really, a real big problem for the council, alongside a shortage of affordable housing in the city. Use of temporary accommodation has become unaffordable and unsustainable. This is a national issue, and it's at the highest level we've seen for 20 years. In the Adult Social Care Committee, we're forecasting an overspend of 2.1 million at Q3, which is the month 9 position. This is a combination of 2.6 million in adults overspend and £500,000 underspend in integrated commissioning, which relates to housing related support, which is detailed in section 1.7.6 of the paper. The committee outturned it actually improve in the quarter by almost £1 million, and that was due to drawdown from grant balances, which offset some eligible spend that was already incurred in the accounts. The service does continue to be challenged by increasing demand and an inflating cost base, and the uncertainty of funding streams from government is not helpful. The committee is reporting an 89% delivery rate on 31.6 million targeted BIPs this year, and the service continues to drive those recovery plan actions, including continuation of the strength-based reviews, solid partnership working with health, and creative commissioning activities and partnership working, as we've heard earlier, to reduce those costs. The risk to the service budgets really are around staffing overspends now, which account for the majority of the variances. The overall council budget plans are on track to deliver 77% of the 47 million that we put in place as part of the 23-24 budget, which is an improvement on the delivery rate of the previous year, which was at 65%. There is, however, an underlying pressure in our accounts for the council of 28.5 million, which does need to be addressed. Some of that's been offset this year through one-off income and grants or provisions, but to be sustainable going forward, we need to sort of address these three key areas of overspend, which does include adults, children's and homelessness. The issues that we face in Sheffield are affecting councils across the country. Some of you might have seen the Panorama programme that was on Monday night, which really brought to life some of the struggles that we're all facing in local government. The latest budget offered no solution either for the pressures that we face, and we are going to continue to have to take action at a local level to tackle these issues. The council put aside 70 million of reserves 2 years ago to manage the overspends that we're seeing in revenue budgets. And at the current rate, we're looking at 13 million remaining by the end of the year. We did approve a further transfer into that reserve of 12.5 million, which was identified through our collection fund surplus. That was approved at full council on the 6th of March. Our medium-term financial position highlights a £61 million gap over the next 4 years. And the good news is we have balanced the budget for 24-25, which was agreed at full council on the 6th of March. And that provided the details of the savings that are needed for the next year. So whilst the savings targets are generally lower than in previous years, it doesn't mean we can relax yet. We must continue to drive the delivery of the budgets and tackle in-year overspends and those underlying issues to make sure the gap does not get any wider. So the paper is just it's a note to note, the committee to note the position at Q3, and the final outturn position will be presented to the committees in June. So happy to invite any questions on the council's financial position in general.
To comment, I think I'm liable to, at the point of going to upset one or two people again, as I did earlier. Alexis mentioned the lack of a plan for the social care estate. There is also no national plan for funding the revenue costs of social care across either children or adults of any description, and they've had enough time to come up with one, but they've not managed it yet. And it's going back to the point that you made earlier about about not having a fair reflection of the costs of producing care for some of the most vulnerable people in this country. And I have to say, I'm not as optimistic as you were in terms of the delivery of the council's balanced budget. Let's be honest, it's theoretical rather than real.
You don't have to answer that. It's a political point, so I think it's unfair to put an officer in that position. But you know, this is a presentation of what the actual delivery of the savings is so far, and where we're struggling. So all we can do in the context of an underfunding that is a national problem and affects social care in particular, we have to just do our best locally to make the numbers work for our people. So thank you, Jane, for the report, and thank you for all your hard work. And if there are no further questions, can we approve the recommendations on page 287, which is the note of the updated information and management actions on the 23-24 revenue budget outturn as described in the report. Is that okay? Brilliant. And that brings the meeting to a close. This is the last meeting of this municipal year, so I want to take this opportunity to thank all the members of the committee for working so hard over the year, reading loads of papers and attending loads of meetings. But more importantly, thank you to all the officers that prepared the reports and keep us informed and work really, really hard, and all the workers that do the actual operational stuff for us. So thank you very much. And the next meeting will be timetabled once the elections are over, but it should be sometime in June. Councillor Phipps.
Thanks, Chair. I just wanted to say thank you to you. I know you've put in a lot of work chairing this committee over the last year. And I just don't understand how we always finish on time as well. So thank you for that.
Councillor Middleton.
Yeah, if I may as well, just reiterate the thanks to Chair for steering us through a really good year of meetings and all the work that goes behind the scenes, and to Alexis and the rest of the team for involving elected members, which is an absolutely thoroughly core part of the governance system we have in this council now. We switched to a committee system. I believe this committee has been taking that very seriously, and involving members in, not just in decision making, but in crafting policy, and giving members opportunities to steer policy directions. And I've really appreciated that, and I've often held it up as an exemplar in the council that other committees may wish to examine and follow. So I'm really grateful for the way it's worked. I hope we can do even more next year. Well, if I'm back next year, I say we, but it might be you. But I hope even more can be done to foster that transparent and co-working culture. I think it's really healthy. Thank you.
Thank you. But it is like a team thing. Councillor Thornton.
I just wanted to reiterate that Councillor Phipps beat me to it. I think, to be fair, you've been a really, really good chair this year, and thank you for keeping us always on time and just really, really thorough. So well done. And yeah, thank you to officers as well. As Ruth has definitely said, this has been a very collaborative committee. It's one where we've had quite a lot of input, and I think that that's really important, and it is definitely a model to follow. So thank you for everyone's hard work, and we'll see what happens at the election. I think there's 3 of us, isn't there, that are up this year. So the makeup may change, but if it doesn't, it'd be great to see everyone next year. We'll see what happens. But thank you.
Yeah, but thank you, everybody, and it's a team effort, as I often say. So thank you to everybody, and see you in June.